everyone, and welcome back to another live stream brought to you by Women's Health and Wellbeing Services. My name is Melanie Robson. I'm here most weeks on a Wednesday live streaming. I was absent last week because I had a break. I was on leave. And today I'm back for term 4 for another weekly dose of live streaming. I live stream on Wednesdays. We also have live streaming that occurs on Fridays as well. I'm a counselling psychologist by qualification, so I tend to live stream on more mental health subjects, psychological topics, mental health, mental illness, those kinds of things. Fridays live streams are more on sort of general health, health promotion, those kinds of things. So we try to sort of spread it out a little bit. And if anyone, of course, has any ideas or suggestions about any topic they'd like me to cover that's related to mental health and mental well-being or sort of psychology for that matter, by all means, hit me up, let us know, contact us via our website or our Facebook page. I will give you those details at the end of this live stream, but I'm assuming if you've seen this or you're watching this, you probably know how to contact us via our Facebook page. So this being a live stream is all about encouraging interaction. If you would like to comment or ask me questions or anything, to say hi, you are more than welcome to do so if you are watching this live on Wednesday the 14th of October 2020. It's just after 11:30 a.m. and we are in Perth, Western Australia, so be mindful of that. But obviously you would know if you're watching this live or not. So by all means, if you are, drop me a line in the little comment box in the bottom of your screen to the right or left, wherever you're kind of looking. And I'm happy to chat. It's kind of really fun to have people saying hi and asking questions, all that kinds of stuff. And I'll do my best to answer. And if I can't, well, I will go and find out the answer for you. So, on to today's live stream. Today, having just said, I tend to talk more about mental health, and Fridays is more about physical health and health promotion and physical well-being. Today, though, I'm actually going to be talking about more of a physical issue more than a mental health issue, although, of course, the topic I'm talking about today would carry some pretty extensive demands mentally and psychologically on a person and on their loved ones around them. So today I'm going to be talking about ovarian cancer and what Frocktober is. So Frocktober is about frocking up, wearing a dress in the month of October. And Frocktober is a month-long campaign presented by the Ovarian Cancer Research Foundation, which exists here in Australia. And they do this every year and encourage people to come on board and have their own little campaign about raising awareness and fundraising for ovarian cancer research. I did it last year. I'm back raising funds and awareness this year for ovarian cancer, and this is a cause that is extremely dear to my heart. I lost a very close friend to ovarian cancer just over 2 years ago now. She was very young. She was 41 years old, and she had 2 young children at the time of her death. And in the case of her name was Tam. She was not diagnosed until an advanced stage, which is very typical, very, very common in ovarian cancer. And this is one of the reasons why we desperately need more awareness and we need way more funds to do research on ovarian cancer so that it can be caught early. Successive governments have tended to sort of undervalue and fund ovarian cancer research. There's so much awareness around about breast cancer. There's a lot of awareness around about cervical cancer, but there's far less about ovarian cancer, and there tends to be a lot of confusion about testing and what tests you can get and how do you know you have it and what are the symptoms and all this kinds of stuff. So hence it's incredibly important to increase awareness about it for every woman and people who know women and love women, so that they can talk to them about it and be aware of what to look out for, but also really go hard in encouraging funding so that research can get to the bottom of it. So where do I even begin? So like I said, ovarian cancer is typically not diagnosed until it's advanced. So that would be stage 3 or stage 4. And when a person is diagnosed in stage 4, their prognosis, frankly, is not good. Generally, the 5-year survival rate for ovarian cancer is only about 29%, which is very, very low, and proportionately more women die from ovarian cancer than from breast cancer, and that is because it is usually caught in the advanced stages. If it's found earlier, like with pretty much every cancer, you're much more likely to survive, to get treatment early, and to go on to live a pretty normal and long life. But of course, the later something is found, the later any disease is found in your body, the less likely it is that you will survive it, really. Pretty brutal kind of stuff. So why is ovarian cancer not found until it tends to be late stages? There are a few reasons for this. Typically, women tend to dismiss, I probably do it too, dismiss things going on in their body. They're so busy caring for other people or looking out for other people or saying yes to other people when they should be saying no, and they aren't really tuned into their bodies. And I would say this is probably true for men as well. And symptoms, I'm going to go through the symptoms. Symptoms can be kind of really vague. You can kind of put them down to, they're just kind of monthly period problems, or they're hormonal, or I'm just having some gastro problems, or my back is just generally sore. I'm really tired because I'm really busy and I'm really stressed, and we can all kind of dismiss those symptoms. And things like weight gain. Weight gain can be a symptom, may not always be, but can be a symptom of ovarian cancer, particularly bloating and sort of abdominal area weight gain for no reason. So I'm not saying you've been eating too many donuts and snacking at midnight every night. I'm talking about, you're gaining weight, particularly around the tummy area, the abdominal area, and you're thinking, I haven't really changed that much about my diet. Like, I don't really know why I'm gaining weight, or why I'm gaining weight mainly in that area. And that can be because you have a tumour that's growing, essentially, and is not showing until it's more advanced, like being pregnant kind of thing. Often too, what can happen, and you've probably all heard stories about this, when a person goes to the doctor and says, look, I'm just a little worried about XYZ going on in my body. I don't know if I'm being a bit paranoid, but is this normal? Is it not? Can you check it out? A lot of the times doctors just give you a pat on the back. I'm just generalizing here. Give you a pat on the back, maybe check you out a little bit, send you off for a couple of tests, don't find anything and go, you're fine. So off you go. Doctor doesn't pick it up, you don't pick it up, and then months go by, or maybe a year or two, and your symptoms are getting worse. So you go back, and it can be really easily missed. And this is why it's just so important as a woman, but as a human being, that if you suspect something is not right in your body, and you've got to, know yourself well, I think, to go, I just have a feeling about this, or something's not right, to get a second opinion or get a third opinion. You have to have your voice heard, and that can be so difficult for many, many women when we're kind of used to just kind of agreeing with things and going along with things, and kind of outsourcing our own knowledge or our own power within ourselves. So if you find that's happening with any kind of issue in your life, just go and find someone who's going to damn well listen to you and validate your experience and go, you know what, I'm going to take this seriously. Let's do some tests here and let's find out what's going on. So that is just a massive tip all around. So what are some other symptoms of ovarian cancer? So like I mentioned, there could be some weight gain, unexplained weight gain, some particularly tummy, kind of abdominal kind of bloating or weight gain. You might be having some lower back pain. There might be changes in the need to urinate. You might be needing to go to the toilet more often. You may be having some bowel changes. Loss of appetite is a symptom, or feeling full quite quickly after eating. That can be, sometimes quite a common one. Let me just check out. Other ones, fatigue can be a big one as well. And again, you can see how a lot of these symptoms, I'm just tired, I'm just stressed, I'm just overworked, and I'm juggling all these kinds of things. I don't need to kind of worry about it. So if you kind of have some of those symptoms, I definitely encourage you to go get it checked out. Who cares if nothing shows up? It's better to go, it's better to be safe than sorry. It's just so true. Even if they do some checks and find it's nothing, or actually you've got a bit of a tummy issue or a back issue, or you might actually have a hormonal issue kind of thing going on, but it's not ovarian cancer. Woohoo! What else have I missed here? None. That's all the symptoms that I mentioned there, and I'll mention them again because it's really important to know them, and really important, as I said, and I'm going to keep saying, to know yourself and to kind of go, what, something's not quite right. Let's talk about early detection. So this is one of the big problems with ovarian cancer, and why it's not found till it's quite advanced, because we are lacking in early detection tests for ovarian cancer. So what about a Pap smear, you might be thinking? Pap smear is about catching cervical cancer. So completely different body part, still in the same area. We're still talking about the female genitalia, the internal genitalia. The cervix is not the fallopian tubes or the ovaries. So, and I mentioned fallopian tubes because researchers found that a lot of ovarian cancers tend to actually start in the fallopian or the uterine tubes. So a Pap smear checks for changes in the cells in the cervix, particularly sort of early stage changes which may be precancerous or lead to cancer. Okay, and we have early detection tests for breast cancer. That would be a mammogram kind of thing. So, we've kind of got those two parts of the female body covered, but not the ovaries, not the fallopian tubes. There is no early detection test. So, hence, becoming aware of the symptoms and going to speak to your GP is really important. The only way to definitively test for ovarian cancer is through surgery, essentially a biopsy of what they suspect may be a tumour. So if you've gone to your doctor said, this might be something here, let's go check it out. Might send you for an ultrasound that can, show things up if you've ever been pregnant, or if you've had any kind of gynecological issues or pelvic or uterine issues, you would have had an ultrasound at some point. They're such fun. Well, the external ones are fun, the internal ones not so fun kind of thing, but really important, and it's so great that we have that technology. So you might be sent off for an ultrasound, and you might be sent off for some blood tests. They can check, there are markers in the blood for all different types of cancers. The one for ovarian cancer is CA125, I think that's right. But they can't, even with an ultrasound and a blood test, it might then really up the ante and go, okay, we legitimately think there's something going on. You're still going to have quite an invasive procedure to definitely test whatever that is in your body to see if it is a type of ovarian cancer. And when I say type, there are many different types. There are about over 80 different types of ovarian cancers. There's some really, the vast majority though, there's some really common ones, or more kind of common, frequent. What are they called? Stromal cell, epithelial, and germ cell. I'm not going to go into the details of those, and actually off the top of my head I can't quite remember. Epithelial is, I think, the most common type of ovarian cancer. So no early detection test, no way to really check it unless you essentially go in for some sort of surgical procedure. Big problem. Hard to know if any symptoms that you're having are actually ovarian cancer or not. Really tricky stuff. Ovarian cancer is the most lethal gynecological cancer. The most lethal. And again, that is because it is often not found to the advanced stages, because there are no early detection tests, because we don't have enough research in the area. And how do we get more research in the area? We need to fund research. We need money. Basically, that's what it comes down to. So this is why I'm back this year actually personally campaigning for Frocktober and for ovarian cancer funds, and particularly awareness. I'm really big on raising awareness about ovarian cancer. So I'm going to go through some more frankly kind of quite scary statistics about ovarian cancer. It's funny, but it's not funny at all because it's really quite confronting. So every 8 hours in Australia, a woman dies from ovarian cancer. So that's someone's mother, their daughter, their wife, their friend, their sister, their aunt, their niece, acquaintance, colleague that is a human life that's lost from this disease. Worldwide, around 322,000 women are diagnosed with ovarian cancer every year. I think I said before the average 5-year survival rate was about 29%, but I've actually got that wrong. It's 46%. So apologies about that, but historically around 70% of women diagnosed with ovarian cancer will find out they're already in the advanced stages of the disease. 70%, so nearly 3/4 of women, when they're diagnosed, will already be in the advanced stages. Here's the 29%. I knew I had the 29% somewhere. So when found in the later stages, when diagnosed, in quite an advanced stage, only 29% of women will survive beyond 5 years post-diagnosis. So yeah, that's another pretty horrendous statistic. But if it is caught in stage 1, so that's early stage ovarian cancer or any cancer, stage 1 early, survival rates are as high as 92%. 92%. So we're going from 29% to 92%. We're just swapping the numbers there. Huge. However, only 19% of cases are diagnosed early due to the vagueness of symptoms and the lack of an early detection screening test. So you can see the problem here. Big, massive problem kind of thing. That if it's found early, we dramatically increase the chances of that woman surviving beyond 5 years. But because we have no early detection test, it's unlikely that it will be found unless it's sort of basically by accident, or you're really, really persistent in going to see your GP because you have symptoms. And I must mention too, you might actually have no symptoms at all, or symptoms that are so vague, it's really undetectable, and it could only be picked up by accident or by, an astute doctor, or having, a quite an invasive test like a biopsy or surgery. 64% of the community incorrectly believe that a Pap smear will pick up ovarian cancer. And like I said, completely different thing for a completely different body part. No, the cervix is totally different. The cervix is the top of the vagina, the bottom of the uterus kind of thing. Whereas we're talking about the little ovaries, the little girls that sit either side, sort of float up above and next to the uterus, attached to the fallopian tubes, and that's where a lot of ovarian cancers actually start, as I mentioned. The number of women being diagnosed with ovarian cancer each year is increasing. It's projected by 2030, 2,200 women in Australia will be diagnosed every year. So currently that's 1,800 women. But by 2030, so in 10 more years, it's going to go up by another 400 women. It could be any of us now watching this. God forbid. You might have heard of the BRCA1 and BRCA2 genes that have become quite famous, quite well known to be implicated in the development of breast cancer, and it's very similar to ovarian cancer as well, that around 15 to 20% of ovarian cancer patients have been found to have genetic mutations of any of those BRCA genes or any kind of similar genes, so BRCA genes. And when there's some genetic mutations on those genes, that typically shows up in the family. So, there'll be various women in the family who've usually had or died from breast cancer or ovarian cancer. So, gosh, if you know anyone in your family who's a blood relative who has had breast cancer or ovarian cancer, and you don't know if they've got this genetic mutation, and you don't know if you have, I would be really wondering about that. It's a very personal choice whether to go and get genetic testing. There's a whole process that goes along with that. There's some genetic counselling. There's discussion of, okay, do I want to know this? What does it mean if I find out that I do have this genetic mutation? That opens up a whole lot of other questions there. Do you then go and get surgery, to prevent the possible development of cancer that you may or you may not get with 15 to 20%? It's not zero, but it's not 60%. So that's quite a complex and kind of an emotional issue there that only that individual would need to kind of sort through and work through on their own. But I would strongly encourage you, if there's any kind of family history of women in your family dying of gynecological or breast cancers, to be really on the lookout yourself for your own symptoms and be getting scans and getting checks really often. Post 40, you can get mammograms that are bulk billed by the government, so that's obviously just for the breast though. When I mentioned the different types of ovarian cancers, epithelial, like I said, is the most common, accounting for about 85 to 90% of ovarian cancers. It's estimated that around 44% of women who inherit the BRCA1 mutation and about 17% of women who inherit the BRCA2 mutation will develop ovarian cancer by the time they're 80 years old. 44%, that's nearly 50% of women may develop ovarian cancer if they have the BRCA1 mutation showing up, if they've had genetic screening, and about 17% for the BRCA2 mutation. Unfortunately for my dear girlfriend, after her death, it was found that she did have that genetic mutation, and she didn't know that. Why would she know that? There had been some family history for her, but no one had got tested. No one had kind of thought to check it out, as I think many families wouldn't, kind of thing. You're like, well, that's what happened to Auntie Betty, and unless there's kind of more awareness about it, and unless I guess there's some more discussion about it within the family. Like I said, it's a really personal issue whether to go and get yourself fully genetically screened, and then what does that actually mean if there are some mutations showing up in your DNA, your genetic code. Well, what are you going to do with that then? And some people would rather not know, and that's totally fine. And I'm not just talking about BRCA1 or BRCA2 mutations. I think it's a Huntington's disease. There's a few different diseases which travel in the family lines. Can't remember which line it comes down, but that you can get screened for, and can see if you have that. What does that mean for you as you travel along in life? I'm not sure. That's a very fraught issue. How about some more facts? So the use of birth control pills has been found to reduce a woman's ovarian cancer risk by 25 to 28% compared to women who've never used birth control. And look, I don't know what type of, that would be hormonal birth control, so the pill. Basically, there are many different types of contraceptive pills with varying degrees of hormones and amounts and synthetic and natural, all this kinds of stuff. So I'm actually not too sure which ones they're talking about there. And that's quite, I guess, an interesting statistic that by about sort of a quarter, it will reduce a woman's chance of developing ovarian cancer compared to women who've never taken the pill. And again, I think that's a really, really personal issue, what contraception you use as a woman if you're having sex with men. If you use contraception, there are many, many different types. I could really go on and talk about that, but this is not really the place. So that's a very personal issue too, whether you want to take hormones as a contraceptive method or as a way to sort of potentially protect yourself against ovarian cancer. But it's not a guarantee. I guess nothing in life is really a guarantee. So, but that's an interesting fact. A woman's risk of ovarian cancer has been found to decrease with pregnancy and breastfeeding. Pregnancy reduces the risk of ovarian cancer by about 30%, which is quite huge. Look, and I'm throwing out these statistics at you, but I can tell you, my friend who passed away, she had been pregnant and she had 2 children. So, but she did have a genetic mutation. So some interesting kind of questions there, I suppose. But again, the research thus far has found that, being pregnant, having a baby and breastfeeding can reduce the chances of developing ovarian cancer. More than 80% of women experience a recurrence of their ovarian cancer after successful treatment and after a period of remission, at which point their cancer is likely to be chemo-resistant. That's shockingly high, 80%. So more than 80% of women experience a recurrence of their ovarian cancer. It's going to come back after successful treatment and after a period of remission. There's an 80% chance it will come back. And if it does come back, it's very, very likely that recurrence will be chemo resistant. So it will no longer respond to chemotherapy. So the standard kind of treatments for ovarian cancer are chemotherapy, surgery, and I think radiotherapy. I certainly know the chemo and the surgery is very, very common. They will often, depending on the size of the tumour and how advanced the tumour is, some treatments are straight away going to chemo to shrink the tumour. They might shrink it before having surgery to remove it. And of course that depends on how advanced it is and if it has spread or metastasized throughout the body. So chemo resistance is responsible for treatment failure and mortality for more than 90% of patients with advanced stage ovarian cancer. So what that's basically saying is that if your cancer has reached the point of being resistant to chemotherapy treatment, you're more than likely to not survive for much kind of longer. There's no, or you might survive, but there's not many other treatment options really, because chemo resistance is responsible for such high treatment failure and a mortality, which is a death rate. Did you know that ovarian cancer treatments have not changed since 1992, which is when I was in year 12? Yes, I'm that old and proud of it. Since 1992, there has been no changes or advances in the treatment of ovarian cancer. That's why we still turn to surgery or kind of chemical methods there to nuke the body and hopefully nuke the tumour and the cancer cells as well. 1992, that's a long time ago, 30-ish, less than 30 years ago. What's going on here? And what is going on is that we desperately need more research in the area of ovarian cancer. There's so much going on with breast cancer. There was a ton of research on cervical cancer, and then the Gardasil vaccination was developed, and it's now routinely given to adolescent boys and girls as a way to prevent the development of cervical cancer. A massive scientific breakthrough that certainly unfortunately was a bit too late for my generation, but like my son's generation, wow, kind of thing, huge. And whether you agree with vaccinations or not, that's kind of a side issue. What I'm just talking about is that research produced this incredible result, which hopefully is going to prevent the development of cervical cancer in a whole generation of women and prevent their deaths, potentially, which isn't that what we want? We want people to live long, happy lives, particularly women. Women, a lot of our issues are internal, because a lot of our body parts, particularly related to our genitals and our sex organs, are internal. So it's much harder to find problems. You might feel that you have a problem, like I said, with some symptoms, whether that's ovarian cancer or, you might have endometriosis or fibroids, ovarian cysts. There's lots of different polycystic ovarian syndrome, so great being female. There's all these things that can happen related to that area of the body, and very hard to detect, because a lot of women too are still really hesitant and fearful and anxious about going to get a Pap Smear. It's not a fun experience. We know it, the doctors know it, it's just what it is, kind of thing. But in terms of looking after yourself, really truly taking care of yourself, these are things that we need to go and do and to take really seriously. And we need to respect that. We need to respect our bodies and go, you know what, there is these fantastic things I can go and do now that has been developed by science and medicine, and I can go and get screened for cervical cancer, and I can go and get checked for breast cancer. Neither of those things are necessarily definitive. They can't 100% say that you have or you don't have something. There's always a false positives and all these kinds of things. But overwhelmingly, that's why we have such mass screening really of cervical and breast cancers, because overwhelmingly they do pick up changes in the cells. That's what we want to see. Is there changes in the cells under a microscope? What does that mean? What are those changes? Are they just kind of little funny things, benign things happening here, or is that indicative of a cancer malignancy? So it's just so important that we continue to fund research into an area like ovarian cancer. Very, very important. Another fact here, the average survival rate for ovarian cancer in 2020, 46%, is lower than the average survival rate for all cancers in 1975 when the modern cancer research sort of era began. The Ovarian Cancer Research Foundation, which do Frocktober, so they're one of the largest funders of ovarian cancer research after the Australian government. What else do I need to say? Frocktober has raised nearly $2.3 million since it began. So for ovarian cancer research, it began in 2007 just by a bunch of women sitting around the table talking about shit, we need... what's going on? We need to raise some funds and raise some awareness. And here we are, quite a few years later, doing this brilliant campaign. I just love it, Frocktober being about frocks and dresses and dressing up. I know my beautiful friend Tam loved dresses. She was extremely girly and feminine, very bright, bold, colourful person and personality. And I barely saw her without a dress ever, and I met her... when I was doing my undergraduate in psychology, which was, what year was that? 2003 or 4 or something like that. She loved dresses, so I just think it's a really perfect way to, broach a subject that is as confronting and tragic as ovarian cancer, and to broach it, in kind of a really, I guess, typical and traditional feminine way by dressing up, by wearing dresses, and by having it run over the whole month kind of thing, so you can really increase your chances of raising money and raising awareness, which is really awesome. Clinicians, researchers and women impacted by ovarian cancer consistently nominate early detection as the number one breakthrough that would save women's lives. So we need a really effective early detection screening test, for ovarian cancer. Remember that there is no early detection test for ovarian cancer, not like a Pap Smear for cervical cancer and not like a mammogram for breast cancer. There is no early screening test for ovarian cancer. With an early detection test, if one was found, it's estimated that over a 10-year period, the lives of 8,000 Australian women and 1.3 million women globally could be saved. Huge numbers. And that could well be someone in your family. That could well be someone that you love. Dear friend, a colleague, any sibling, something like that. So this is why we need so much more awareness of ovarian cancer. And whilst we don't have early detection tests and good ways of catching ovarian cancer early, there's that slogan for, I think, bowel cancer. It's like catch it early or something like that. It just popped into my head. That's quite effective because I just went, catch it early. That's a bowel cancer thing, so instantly you kind of know that. But there's far less, I think, awareness out there about ovarian cancer. Hence, campaigns like this to increase awareness is so important. In the month of February, there's also Teal Day, which is about raising awareness of ovarian cancer. That's put on by another organisation. I can't quite remember off the top of my head. So there are 2 events going on every year, really, about this. So until there is an early detection test, and until we can find ovarian cancer early, which, remember, that dramatically increases a woman's survival rate right up to like 92% instead of 29% if it's caught in stage 4. And so until we find the early detection test, it's all about knowing the symptoms and all about, really tuning into yourself and your body, and perhaps being familiar with any kind of issues that have happened in the family related to cancer. Typically, if you know your family, some of the illnesses and the problems really that have affected a family. And if that has been you with breast cancers floating around the family or ovarian cancers, you might want to just keep a closer eye on yourself, really, and take it very seriously, and to just be on the lookout for symptoms. I think, screw it. It's better to be more paranoid and go and get some help, or go and see your GP and say, look, I'm a little concerned. and for them to just go no, or for them to go, you know what, we will take it seriously. And remember, if they say no and they don't think it's anything to really worry about, but deep inside you're like, no, I really want to get this checked, just go somewhere else. Find someone else. I know it's really hard to find a really good GP. Believe me, I know that's really tricky. And to find a good GP who'll really listen to you, who'll really take you seriously, take your concerns seriously, validate you. You know, that's just so important. I think we all know what it's like to feel unheard and dismissed and invalidated, or made to feel kind of stupid because we're coming in with this problem or this kind of worry. Just if that happens, you know, talk about it with a friend, have a bit of a whinge, but go and find someone else. Really, really do that. You know, just do not brush it aside because someone outside of you has told you that you're being silly or dramatic or whatever kind of thing. You must dismiss that stuff as much as they've dismissed you. You know, this is when it comes to your body and your health and your well-being, physically and mentally, you know, you have to take yourself seriously. You have to put yourself first. We're so busy, like I was saying, we're so busy generally, but we're so busy caring for other people, typically women. You know, we care for our children and our partners and parents and friends that are going through issues, and hopefully we're equally supported. But often we're so busy with our caretaking kind of roles and working and juggling all these kinds of things. It can be really easy to, I think, just dismiss stuff that's going on within you. Particularly if you started to notice any kind of weird stuff going on in your body. And that can be really frightening. And I think for many people, the initial response, apart from the panic, is kind of denial. And you kind of go, oh, you know, I'm just having a bad day, or my tummy's a bit upset, or I'm a bit stressed, or I'm not eating right, you know, all these kinds of things. You know, I think that's a really normal and very common response. Shoving your head in the sand kind of works for a tiny amount of time, but really in the back of your head there's this voice yelling at you saying, get your head out of the sand, go and talk to someone about it. You know, GPs are trained in seeing all sorts of problems. You know, they're kind of a jack of all trades in that regard. So they have seen every body part, every condition, weird, wonderful, gross, amazing, confronting, you know, all that kinds of stuff. That's their job, you know. They're sort of the gatekeepers before they send you on to a specialist. So you're going to have to go through a GP anyway and just say, you know. And again, even if they don't want to do a thorough check, but they say, well, you know, you can really insist for a referral to go see a gynecologist. You know, go and see someone who's more of a specialist in the area of women's anatomy and women's issues to do with their gynecology kind of thing. But you're going to have to go to a GP first. So again, if they don't want to send you on or don't want to refer you to someone else, go and see someone else. I really cannot emphasize that enough, the importance of listening to yourself. And if you're getting a few checks but nothing is kind of being found and it's all a bit vague and mysterious, you really got to take that seriously as well and really pursue that further, because it's kind of like someone's not joining the dots here. You know, I think that can definitely happen when there's stuff going on in the body, but it's not sort of centrally located. It's kind of something's happening here and something's happening there. And then when you couple that with stuff happening in your life outside of your body, you know, there's stuff happening over there with that family member, there's stuff happening there with the work, there's stuff happening there with the kids, there's stuff happening over here with the other commitments that you have, you know, there's just stuff everywhere. We really, I think, as women need to learn a few things. We need to learn, myself included, to be still, to be quiet for a little while, even if it's 2 minutes of a day, to be with ourselves without any other disturbances. We need to learn to have boundaries, to say no, you know, and to put ourselves and our needs first. We really do, because we cannot take care of other people unless we're taking care of ourselves first. Because if you're running on empty, good luck to you. That will not last very long. You will get burnt out, you will get exhausted, and you may well get sick. You know, I think stress is a very real and very serious factor involved in a lot of illness, you know, physical and mental illness as well. There's stack loads of research on stress and the body, you know. So we need to take that seriously. We need to take ourselves seriously, and we need to allow ourselves space and time to pause and to listen to ourselves and to tune into our body, to tune into our intuition, to tune into the little voice in the back of your head going, you know what, you really need to go to the GP and get this checked out. You need to honour that. You know, that's a gift that we have, that all humans have. It's the kind of intuitive parts of us. But if we're so busy and so rushed and so kind of loud, we block all of that out. You know, and that's not cool. It's not healthy, physically or psychologically, to be that kind of frantic. You know it. You know that it's not good. It doesn't feel good to live like that. So again, I'm just encouraging you to take it back to yourself and to really listen to yourself, and then to find other people who will listen to you and will take you seriously. That's my little rant. Before I finish up, I just wanted again to just quickly go over some of the symptoms that may show up for ovarian cancer. You know, bloating in the tummy or abdominal area, weight gain generally, or weight gain in the area that can't really be explained by any dietary changes, loss of appetite, feeling full very quickly after eating could be a symptom, increased need to urinate, bowel changes, backache, fatigue. And I know these things are pretty general and pretty vague, but if you have a few of them, might want to just think about that. Remembering that the problem with ovarian cancer is that it is often not found until the advanced stages, and that is because A, of the vagueness of symptoms, but B, no early detection test. So we need research in that. So we need funding to research that. Remember the amount of lives that can be saved. You know, within 10 years, if we had an early detection test, that's about predicted to be 8,000 Australian women and like over 1 million women worldwide whose lives could be saved if we had that early detection test. We've got the early detection test for cervical cancer, that's a Pap Smear. We've got the early detection test for breast cancer, that's a mammogram. What about the ovaries? Kind of thing. There's a lot of other stuff going on down there. So, yeah. I'm going to wrap it up now. I'm talking a little bit less. Usually I talk for an hour, but it's going to only be about 45 minutes today. Really, thank you so much for listening, watching this. If you've tuned back into it, I hope it's been educational and informative. That would be certainly my goal in presenting this today, just to raise some awareness about ovarian cancer, to take it really, really seriously for yourself or for any women in your life that you know. I will be back next week live streaming. Next week though, my live streams, starting from next week, will actually be moving to a Tuesday. I'm going to be running a group on Wednesdays, so I can't do two things at once. Strange but true fact about me, I cannot do two things I can, but not run a group and live stream at the same time. So I'll be back next week, and predominantly throughout the rest of this term, my live streams will be on different mental health issues and conditions. So next week I'm going to be talking about depression. So if you have any questions about depression between now and then, by all means send them through or join me for that live stream, and I can see if I can answer any of your questions. You're welcome to drop us a line, send us any feedback, any suggestions, anything like that, via our Facebook page, via the little messenger thing there, or direct message us. You can also hop onto our website. We run lots of different groups, lots of different things here, internally and online. www.whws.org.au. You can email us info@whws.org.au. You can also call us, remembering we're in Perth, Western Australia. The number's 94902258. Lots of different ways to communicate with us. So thank you for listening. I hope it has been a little bit useful for you, and I wish you all the best in your physical and your mental health. Take care, and I'll see you all next week. Bye.